Chronic mucus buildup in the airways affects almost 1 in 4 adults over 40. Most people think it's just a persistent cough or a constant need to clear the throat, but in reality, when sputum production becomes persistent, your airways are being damaged every day. Over time, this ongoing inflammation and mucus retention can lead to irreversible lung damage, one of the top 4 causes of death worldwide due to chronic lung diseases. If mucus and cough last for more than 3 months a year for 2 consecutive years, this condition is called chronic bronchitis, a major form of chronic obstructive pulmonary disease, COPD. Chronic bronchitis slowly destroys the bronchial walls, narrows the airways, and reduces oxygen delivery to body tissues. The good news is that regularly clearing your bronchi and lungs can greatly improve your quality of life, reduce flare-ups, exacerbations, and even extend your lifespan. That's why in this guide, I'll show you the scientifically proven, natural, safe, and effective ways to help your airways clear mucus and let you breathe freely again. Normally, our bronchi and bronchioles produce a small amount of mucus every day. This is completely normal. Mucus keeps the airways moist and helps trap and remove dust, bacteria, and other particles from the lungs. However, when the bronchi become chronically irritated or inflamed, they start producing too much mucus. This excess mucus becomes sticky, begins to clog the airways, and further triggers inflammation, creating a vicious cycle, the hallmark of chronic bronchitis. This condition usually develops after the age of 35 in smokers and after 40 in non-smokers. In people who have frequent viral infections, it can appear even after the age of 25. After repeated infections such as influenza, COVID-19, or respiratory syncytial virus, RSV, the airways can remain oversensitive, a condition known as post-infectious bronchial hypersensitivity. The most common sign of excess mucus in the airways is a morning cough with phlegm. The second most common sign is the need to clear the throat repeatedly during the day. Other frequent symptoms include a feeling of something stuck or tightness in the chest, wheezing, or noisy breathing, shortness of breath, or discomfort during physical activity, frequent respiratory infections. These symptoms are usually worse in the morning or in cold air. Sometimes a person may even notice a metallic taste in the mouth, another sign of airway inflammation and excess mucus production. When mucus lingers in the airways, it becomes a perfect home for billions of bacteria. These bacteria start forming colonies and then wrap themselves inside protective layers called biofilms, sticky shields made of proteins and sugars. Inside these biofilms, bacteria become hundreds of times more resistant to both antibiotics and immune cells. Even strong antibiotics cannot penetrate the biofilm barrier, and immune cells like macrophages cannot eat or destroy bacteria protected inside it. As a result, infections keep returning and inflammation never stops. That's why when we want to clear the lungs from mucus, we must address 4 things at the same time, treat the underlying cause, such as infection, allergy, or chronic irritation. Normalize the mechanism of mucus production, reduce overactive glands and inflammation, make mucus easier to cough up by thinning and mobilizing it, disrupt biofilms directly so trapped bacteria can finally be cleared. Now let's talk about treatment. The first and most definitely effective supplement is N-acetylcysteine, NA. It helps clear mucus and reduce airway inflammation because it breaks disulfide bonds in mucin, which makes mucus thinner. It also replenishes glutathione, the main antioxidant in the lungs, protecting cells from damage. In people with chronic bronchitis, long-term NAC intake leads to fewer exacerbations and less viscous sputum. The standard dose is 600 milligrams twice a day with meals. During flare-ups, it can be taken 3 times a day for short periods. NAC is also liver protective and safe for the kidneys, so long-term intake is possible. The second important supplement is bromelain, a proteolytic enzyme extracted from pineapple stems. It digests mucus and biofilm structures, providing a powerful mucolytic effect by cutting protein and glycoprotein bonds that make sputum thick and trap bacteria. When combined with NAC, the effect becomes synergistic. NAC breaks the bonds and bromelain digests the proteins. Together, they act like chemical scissors and an enzyme cleanup system. Bromelain also has anti-inflammatory effects on the bronchi, reducing swelling and airway inflammation. It has circulatory benefits, works as a mild anticoagulant, improves microcirculation, and lowers the risk of clots. The optimal dosage is 500 to 1000 ml twice daily, taken 60 minutes before meals, preferably on an empty stomach, because food proteins reduce its systemic absorption. It can be used long-term in cycles, for example, 3 months on, 1 month off. Bromelain is safe for the liver and kidneys, but it should be used with caution in people taking blood thinners like aspirin or warfarin. Overall, bromelain is considered extremely safe for the body. When taken together, bromelain plus NAC are about twice as effective as either alone, reducing sputum viscosity by around 60%. Quercetin is a natural flavonoid found in apples, onions, and capers. It acts as a mast cell stabilizer, antioxidant, and biofilm disruptor. When combined with zinc, it becomes a biochemical firewall, protecting airway cells from both inflammation and infection. Mast cell stabilization means fewer inflammatory mediators, less histamine, leukotrienes, and prostaglandins released after viral infections, cold air exposure, or allergens. As a result, quercetin reduces airway hyperreactivity, helping prevent the tight chest sensation that follows triggers. It also suppresses mucus overproduction at the gene expression level, reducing mucus by around 30% in studies. Additionally, it inhibits bacterial quorum sensing, which limits biofilm formation. For best absorption, quercetin should be taken with food and vitamin C. Typical regimen, 500 milligrams twice daily with zinc and vitamin C. Because quercetin is fat-soluble, it's best taken with meals containing olive oil, avocado, or omega-3 fatty acids. Alternatively, quercetin plus bromelain formulations provide 2 to 3x better absorption. It is suitable for long-term use and is generally well tolerated. The fourth supplement is curcumin with piperine. Curcumin, the active compound in turmeric Curcuma longa, is a potent anti-inflammatory and mucus-reducing agent. It works by inhibiting the key gene responsible for mucus overproduction in airway epithelium. Curcumin also disrupts bacterial biofilms, making infections less persistent. Beyond the lungs, it reduces systemic inflammation and improves joint health. Dosage: 500 to 1000 milligrams twice daily with food. Curcumin is poorly absorbed on its own, so combining it with piperine from black pepper increases bioavailability up to 26. Long-term use is considered safe in standard doses, but high doses may cause mild gastrointestinal upset in sensitive people. The fifth supplement is magnesium, preferably in the form of magnesium glycinate or magnesium citrate. Magnesium relaxes bronchial muscles and calms airway nerves by blocking calcium-mediated contractions in smooth muscle cells. It also supports over 300 enzymatic reactions, including those regulating oxidative stress and inflammation. Low magnesium levels are linked with increased airway reactivity and poor sleep, making supplementation especially useful in airway-sensitive individuals. Dosage: 200 to 400 milligrams daily, taken in the evening or split into 2 smaller doses. Glycinate is best for calming and sleep, while citrate offers mild laxative benefits. The sixth supplement is vitamin C ascorbic acid. Vitamin C boosts NAC's antioxidant cycle, strengthens mucosal immunity, and enhances collagen synthesis, important for airway and vascular health. It also improves iron absorption and supports neutrophil activity, making infections less severe and shorter in duration. Dosage: 500 milligrams twice daily with meals. For those with higher oxidative stress or recurrent infections, up to 1 gram twice daily may be used safely for limited periods. Vitamin C is water-soluble, so excess is excreted in urine.
The seventh supplement is probiotics, especially Lactobacillus rhamnosus and Bifidobacterium longum, or multi-strain formulations. Most people think probiotics only work in the gut, but that view is outdated. Modern research confirms the existence of the gut-lung axis, a biochemical communication pathway between intestinal microbes and the respiratory immune system. This axis plays a major role in airway inflammation control and mucus regulation. Regular users of probiotics experience about 30 to 40% fewer upper respiratory infections during winter, according to meta-analyses. They also release bacteriocins, natural antibiotic peptides that suppress harmful bacteria like Streptococcus pneumoniae, Haemophilus influenzae, and Pseudomonas aeruginosa, common pathogens behind bronchitis and COPD flare-ups. The standard dosage is around 10 billion CFU colony-forming units per day, taken in the morning or with the first meal for at least 3 months. Some probiotics require refrigeration, but freeze-dried, lyophilized types are more stable and convenient. High-quality products often use microencapsulation or inulin-based stabilizers, protecting bacteria from heat and moisture. These can safely stay at room temperature below 25 degrees Celsius for 12 to 24 months if kept sealed and dry. Look for labels saying shelf stable, no refrigeration required, or heat-resistant strains.
Now let's talk about core medications. The first medication is Ambroxol. It helps reduce mucus viscosity and also stimulates its clearance. Ambroxol doesn't just thin sputum, it activates the lungs' surfactant system, the same system that keeps the alveoli air sacs open. When surfactant production increases, mucus slides outward instead of sticking to the bronchial walls. Ambroxol stimulates type 2 pneumocytes, boosting surfactant release and increasing the amount of thin, watery secretions. It also enhances ciliary beat frequency, the rhythmic movement of the tiny hair-like structures that sweep mucus up and out of the lungs. When combined with N-acetylcysteine NAC, their effects complement each other. NAC breaks the mucus's chemical bonds, while Ambroxol promotes flow and clearance. Studies in chronic bronchitis show around 30 to 40% faster sputum clearance and 25% fewer coughing episodes within 1 to 2 weeks. In patients with cold-induced bronchospasm, Ambroxol indirectly reduces airway spasm by lowering inflammatory mediators like bradykinin and prostaglandins. Dosage: 30 milligrams 2 to 3 times daily, or 75 milligrams extended release once daily. Take it in the morning and midday, not late at night, because as mucus loosens, coughing may increase temporarily. Ambroxol is safe for long-term use and has a neutral effect on liver and kidneys.
The second medication is theophylline. For decades, it was considered outdated, but in low, well-controlled doses, theophylline remains one of the most effective airway stabilizing agents, especially for people whose bronchi constrict in cold air or stress. Theophylline shows anti-inflammatory effects similar to low-dose corticosteroids, but without their systemic side effects. It also reduces airway hyperreactivity, making cold-induced bronchospasm significantly milder. The third medication is the inhaled bronchodilator anti-inflammatory combination. It includes 2 main categories, A, Short-acting bronchodilator, levosalbutamol or salbutamol, albuterol, provides fast relief from bronchospasm, especially triggered by cold air, stress, or allergens. B. Long-acting muscarinic antagonist LAMA tiotropium or glycopyrronium, used for once-daily maintenance therapy in people with persistent morning tightness or mucus buildup. These drugs block M3 cholinergic receptors, preventing reflex airway constriction caused by cold, smoke, or dust exposure.
Dosage, tiotropium 18 microgram. It is usually one inhalation, or glycopyrronium 50 microgram once daily,